particular, let's talk about a burns patient. In a burn, you get swelling. This swelling produces pressure. This back pressure pushes back the partial pressure of oxygen, so it pushes away and prevents the circulation from getting through. The blood vessels are crushed by the pressure of the swelling, and it prevents the oxygen diffusing.
I've got microbiosis on my legs, and it's a lot better. It used to be really bad, now it's a lot better, and I have hair even growing on them, and I'm using it as well for my eyes.
But if you have the pressure of oxygen increased to 10 times or 12 times, then the oxygen can fight back through the inflammation and accelerate the healing process and cause the inflammation to reduce.
I have retinopathy, and I was supposed to need laser treatment, but it fixed it.
Is there anything else you want to mention in particular?
That's what I use the thing for. I had also ulcers, and it used to take about a year to cure, and it was cured in a couple of sessions.
That's a little bit of the physics behind it, but we know that oxygen reduces inflammation, it oxygenates the tissue, which needs oxygen for healing, just like it needs glucose and it needs water and everything else, it needs oxygen. And it also promotes the growth of new blood vessels. So oxygen has been found to have through a multiple series of mechanisms, to have a beneficial effect on injuries, especially burns and chronic ulcers, either because of venous circulation in the legs or because of diabetes, which is another common cause.
Absolutely, yes. Yes, Michael is more alert, he's more with us than he was before. He started the first session in March. We noticed that a general improvement. And then the second session before the summer, the second series of sessions, we noticed some definite changes. For example, he began to give little kisses to people, which he'd never done before. He began to follow a story when his mother read the story at bedtime, something which hadn't happened before. And now, after the summer, another session, and now he is jumping, which is something new again. He hadn't done that. So yes, definite improvements.
It has made a very positive effect. I was, like I told you before, 7 weeks bedbound. The only thing that the UK specialist told me to take was Prozac, and they told me not to. The chief minister told me not to take Prozac because I'm doing this, I'm trying to fight with the government to get some funds from there. And to be honest, I wasn't planning to take Prozac, but since I've started the oxygen, I'm a completely different new person.
Hello everyone, and welcome to This Week in California. I'm health editor Diana Penna, and boy do we have an amazing show for you. It's the story of a little Sacramento girl whose doctor said she'd never make it. We'll also explore the controversial treatment that's helping her do the everyday things we all take for granted, and her family's fight to try and make more families aware of this breakthrough. More on that in just a moment. But first, the beginning of little Rebecca Nemeth's story. She was part of a state video focusing on people with disabilities called The Power of Dreams.
We had made a personal decision to take her off life support to end her life. She was supposed to die in her arms in 10 minutes. Somehow, she had stopped breathing twice, caught her breath both times, and from there, we went through the day, and about 10 o'clock that night, we put her to bed, we kissed her goodnight, and literally, she opened her eyes and started moving her arms and legs and crying. Every day since then, Rebecca has been a fighter and a worker. She works very, very hard to do everything that all the other kids want to do. With all the challenges we've had, we've just looked back and see Rebecca and see how hard she had to work to get here and how hard she has to work for everything. So when we have to fight with insurance companies and fight with this and fight with that for her, it's easy because we have a role model to lead us.
Well, with Rebecca for Inclusion, to me being a child and being alive. She is a child. She's 5 years old. She has every right to be a 5-year-old, to go to school, to play with her siblings, to sit up, to stand, to walk. And I can't deny her of it.
She wants to do all the things that other kids want to do. She wants to walk all the time. All of a sudden it's come up, she found she could do it, and she wants to walk all the time. If Rebecca can work so hard to do so little, I think I can enjoy this and get through this.
First, let's talk about what it is.
Well, hyperbaric oxygen therapy has been around since, I believe, the 50s, and all it is putting the person under pressure of 1.2, 1.3 to 1.5, 1.75 atmospheres of pressure.
Right.
And giving them 100% oxygen. And they use it, it's used for crushed injuries, if you have a crushed limb in a car accident, or if you had diabetes with a sore that wasn't healing, they'd give it to you. A broken bone that wouldn't heal, they would give it to you. So it's a very accepted technology. And the medical principle is very straightforward. Under any type of pressure, oxygen dissolves in the blood serum. And it's very simple, it's very straightforward. And when it dissolves in the blood serum, what occurs is that the oxygen will get to every part of your body without any interference. If you have an injury, there's coagulation, there's a blood clot, there's capillaries that are injured, so the red blood cells can't get through to the area that's most effective.
Right. And
carry the oxygen there. But when it's dissolved in the serum, it can go through the lymph serum, can go through the cerebral spinal fluid, and it'll just bathe every cell in the body with oxygen. What it does with children like Rebecca and stroke patients and anybody with a brain injury, it does essentially two things. It'll wake up neurons that are sleeping or metabolically inactive because of the lack of...
She's happy to be here.
It'll wake them up. They may not be getting enough blood supply, so they're not active.
Right.
Okay.
I want to show something now, because you're going down to Florida to do this at who is considered the pioneer of this therapy, Dr. Richard Neubauer, and he has some dramatic case examples, and this is when we want to show you some video. This is what Rebecca has been doing, and we're going to talk about her progress, but I want to show you this. Little boy was normal, fell into a pool when he was about 3 years old, and it was a case of near drowning, causing severe damage to his brain. He had many treatments in the chamber. There he is. That's one of the chambers. Not too happy to be in there, but it's good that a family member could be in there as well. And look at him after those treatments. That is the kind of change that takes place. Not all children will have this kind of remarkable recovery. We have another one coming up after this little boy. This is amazing. Again, dramatic examples. 14-year-old girl with diabetes. She had a severe bout of hypoglycemia with seizures. As you can see, it takes 3 people to actually help her stand. She's in a lot of pain. After several treatments, there's the chamber. She's getting out of the chamber. She's smiling and looks and feels better, according to her family and doctor.